with that, we're going to transition to a panel. We're really excited to be able to build off the discussion we've been having earlier this year. We've talked some about the challenges to public health authority, as well as the need to really think about how to engage communities and coalitions, and thought today we could hopefully bring that all together. The town hall, the meeting we have with Lights, Camera, Action, is certainly something that as we try to figure out where we're going next with COVID and with kind of everything happening, these are all really important ways to think about how we bring on new partners and we keep the ones we have engaged. So today we are really lucky. We're going to have 3 presenters tell us a little bit about what's happening in their part of the world and lessons that they have. And so we're going to go in the order on the screen, but first we'll have Lisa Dwork, who's the Executive Director at the Confluence Public Health Alliance. That's actually a new name for a combined organization of the Montana Public Health Association, I believe the state, local health officials, and the State Environmental Health Association. So we also thought the fact that they're collaborating daily was another great example, but they've dealt with some really challenging legislation over the last year or two where partners have really been needed. Then we'll move on to Katie Bishop-Kendrick, who is at the American Heart Association. She works with the Voices for Healthy Kids initiative. Hopefully you all know they do a lot of work at the state and local level on bringing people together around public health, and now are also looking at this public health authority issue with us. And so thought hearing from them past examples of successes and how they've worked would be very informative to us, as well as thinking about specifically these challenges to public health authority. And then last but not least, Alice from Made to Save is going to tell us some about all the great work they've done over the last year or so, thinking about how to get access to vaccines, especially in communities that aren't always as well represented and have the voice and the health impact that they would like. And so they've really done some great work with community-based organizations. So we really wanted to take an opportunity to learn from them what we may be able to do to keep these partners engaged, as well as to think about the work we're doing. How do we really best pull these partners and connections and collaboratives together? So with that, I'm going to turn it to Lisa. We're going to ask each of them to give some comments up front, and then hopefully we'll have some time for some questions. But would ask everybody just to please use the chat feature as we have. I think we found it's really helpful and that we really get some great lessons and discussion there too. So Lisa, thanks so much for joining us.
Thanks so much, Angie. Can everyone hear me and see my screen?
I can.
Excellent. So I'm not going to put into presentation mode because my screen will go black and I need my notes, but hopefully it's, not too distracting. The slides on the side. So as Angie mentioned, my name is Lisa Dwork. I'm the new Executive Director for Confluence Public Health Alliance. And I've been in my position for 2 months, but have a whole team supporting the information that I'm going to share with you. So we are really excited to share what we've experienced in Montana. And I'm going to just briefly share who we are a little bit and then really dive right into the challenges that we face and what we envision as our path forward. So our new alliance, as Angie mentioned, represents 3 public health advocacy organizations within our state. And the alliance is truly a uniquely Montana solution to strengthening the nonprofit policy and advocacy and workforce representation, so those members of ours, that piece within the public health system. We don't have a website yet, but I'm hoping to share more about our structure and where we go in the near future with everyone. Let's see. So in Montana, the local governmental public health system is decentralized. This means that 58 unique county, city, county, health districts and tribal agencies provide an array of public health programs, services, and protections. So state law gives local communities really a lot of local control over public health policy and practice. And this is just really important to know as we talk about what we saw happen at this session. So the Montana legislature operates on a biennium, and this means that every 2 years, our citizen legislature goes to Helena, our state capital, for 90 days. And in 2021, we saw nearly 24 bills introduced to limit and control the tools, essentially, the power of local boards of health and public health authority. And what we know is that these bills were a direct response to COVID-19. And so the long-term implications were just not considered whatsoever. And we're seeing some repercussions of that already. The three primary bills that some of the challenges we face include House Bill 121 and 257, which really focused on public health authority, and then House Bill 702, which really emphasized vaccine discrimination. And so the public health authority pieces that changed significantly included, first and foremost, state law limits the authority of boards of health through the new creation of a local governing body. And so now our boards of health, which include representation from electeds inherently built into that, and have often public health background or a medical background, must propose regulations for adoption to this new local governing body. And in most situations, that final body with the control is county commissioners. So for simplicity's sake, governing body is county commissioners in most situations, and is truly elected officials without public health training. Second, we saw in regards to emergency and disaster declaration that any orders issued by our boards of health or our health officers now only can remain in effect until the majority of this new governing body move to change the mandate. So a health officer might put an emergency mandate in place, and then as soon as the governing body wants to change that, they effectively could. And then third, is this, these bills really did eliminate local authority to enforce resolutions or ordinances that interfere with a customer and business relationship. And so this was in direct response to mask mandates. And what was interesting here is the language was really broad. And so what it did is it created some, less likely cross-sector partners that are concerned about this that normally might not, join and support for public health. And then House Bill 702 added vaccination status to the list of classes that's protected under the Montana Human Rights Act. So we can, therefore, government agencies and businesses are prohibited from denying services to individuals based on vaccine status. And our Montana Medical Association, who is a great public health partner, has already filed a lawsuit against this bill. So that's an interesting one too. And those were just three bills. So the immediate and long-term direct and indirect implications of this are really far-reaching. First and foremost, public health, we're seeing more so now than ever, is ruled by politics. And, we know that our public health workforce is experienced, they're skilled, they're credentialed, our board of health are trained, often do have public health background. And now there's a real lack of understanding and a lack of respect for those qualifications. And this new authority, really does rest with those who are politicians and two, most often do not have public health training. So this is very concerning. And I think what's perhaps most interesting to folks here is that we have this decentralized public health system, but what we're seeing is a lot more centralized control at the state level. Public health authority was stripped of many of its tools, and there was a direct impact to the healthcare system. So our medical providers are really recognizing that when public health doesn't have the tools to do its job, they are seeing that the fallout from that. And we had 26 lead local health officials resign in our state. And so I have a map to show this because it is also not unique to Montana, but does show that across our really diverse geographical and cultural state, this happened everywhere. And yes, some retired, but most were really driven out of their jobs. They weren't supported, they were harassed. We all know what happened there. And this didn't just happen at that lead local health official position, it happened across the board at every level within the public health departments. And our state is truly having a public health workforce crisis. So, our Joint Policy and Advocacy Committee really does represent the public health policy leaders within the state, and they represent the three organizations that are part of our alliance. And we are really trying to figure out how to rebuild as we come out of the pandemic and be a lot more strategic in our legislative priorities. We are recognizing that public health is very political in our state, and public health for a long time has felt really safe and really comfortable in the policy bucket. But we have to figure out how to be effective in the politics bucket. This is a big ask for lead local public health officials who have, just various support and relationship with their electeds. And so it can't all be on that lead local position. They're one person, and when 26 of them leave, there's a lot of rebuilding to do. So during this interim, we're focusing on grassroots advocacy. really, we have the citizen legislature, the state representatives in the most rural corners of our state have a lot of power at our state capitol. And so what is that network of relationships within each county between lead locals, key staff, allies of public health, and how do we create this sort of groundswell of pressure to get our policies, to safeguard our policies at the state capitol. And then, just as Susan shared during the opening, we really are relying on the work of the association, or the American Public Health Association, and maintain that national pulse. So the playbook that our governor is using is a direct sort of lift and steal from national agendas. It's very predictable, and we only meet every 2 years, and so it gives us sort of this interim year to see what's happening across the nation. Looking ahead, we expect legislators to try and legislate standards of medical care, continue to strip public health of its ability to use tools and evidence that we know works for health. There's already efforts to eliminate immunization requirements within daycares. We're anticipating loads of preemption politics. And so we are truly looking towards multi-sector work. We have to think outside of public health. There is a big push here for local solutions coalition work. We really do need to grow the people outside of public health that can advocate for public health. And we're looking for unifying issues. So things beyond COVID, behavioral health has support across the aisles. And so that is something that our committee is looking to elevate and prioritize in addition to public health authority, immunizations, tobacco, and food safety. And then finally, this keeps coming up, but in Montana, our executive branch for a long time was a Democratic governor. And so there was sort of a stopgap measure in place, but now we have a more conservative governor and a conservative legislature. And so what role does the judicial system have in, serving to sort of right the wrong in some of these policies that are getting passed? And we've already seen that play out. So that is very costly and we have limited resources, but that is one thing that our committee is really starting to clue into. And that's most of what I wanted to share with everyone. I do want to just thank the American Public Health Association for letting us share and really for their support. Again, I've been in my role for 2 months and I've already felt that the support from the association has helped us establish the alliance and devise a plan forward for our legislative work. So.
Thanks so much, Lisa. I think hearing about what's happening in a state that really has dealt with a range of challenges, the creative partnerships that you've come up with. I loved your thought about getting beyond policy to politics, which I think is something that a lot of us need to be thinking about how we can do it. And with that, I will hand it over to Katie. And everybody, I'm sure you have lots of comments from Lisa, so either put them in the chat or save them and we'll come back at the end.
Sorry, just figuring out where the mute went.
Okay,
I started sharing my screen. Can you all see my screen?
We can, thank you.
So I am Katie Bishop-Kendrick with the Voices for Healthy Kids initiative at American Heart Association. We work on state and community policy initiatives to improve the health of children and families, and all of our work is rooted in equity. And I specifically work on our preemption project. So for folks who aren't familiar with preemption, preemption is when a higher form of government, like the state legislature, tries to impose policies that limit what lower forms of government can do. So city council or boards of health. And as I'm sure you have all been talking about, and I've heard already come up on this call, recently we have seen a lot of attacks on public health authority, and preemption has been one of the tools that has been used to do that. So we've seen this as a reaction to COVID around mask protocols or vaccine protocols, but we've also seen this for a long time around other public health issues. So things like tobacco control or healthy eating policies, policies to put minimum wage requirements in at the local level, or paid family leave. And so in our work, we support state and community campaigns We provide support and technical assistance to them. We also re-grant dollars to campaigns. We do trainings and create tools all to support them. And one of the things that we have seen is that in this work, strong and effective coalitions is one of the key components to policy success. And so I had the opportunity to talk with my colleagues that are working directly with our grantees and with our AHA field staff across the country to just pull out, what are some of those key things that coalitions do to really make them strong and effective and to maintain that strong coalition. And so some of the things that came up were having a joint statement. So coming together as a coalition, having that clear message of what the goals of the coalition are, what it means to be a participant in that coalition, and also what some of your key messages are, so that when you're in the heat of the moment, you're responding to something, you don't have to deal with the nuances of messaging because you've already crafted some of those core pieces. Also around coalition management, having a specific person that is in charge of reaching out to the membership to develop agendas, to be setting priorities, to be coming up with strategy so that the coalition is staying on task and continuing to move forward and staying cohesive. But one of the core components of that is that the actual person who's responsible for that, well, they can be a staff member of one of the member organizations, they do need to be able to wear two different hats. So they need to be able to represent the interests of the coalition members and not just the interests of the organization that they work for. Another tip that we've seen be really successful is having an annual check-in with members. This really helps with the maintenance piece of coalitions. So having that meeting where you're asking members, what can they bring to the coalition in the upcoming year, and what are they hoping to get out of the coalition in the upcoming year? And we do have some tools that can help coalitions to have those give and get conversations as a coalition. And also just doing continuous follow-up throughout the year. So checking in as a coalition, talking about, are your tactics that you've just employed, were they effective? Did you reach the audience that you were trying to reach? How did your messages resonate? And really seeing, if you're not hitting your intended audience, if your messages aren't hitting the mark, who do you need to be bringing to your coalition? How do you need to be changing your messages to really become more effective over time? And these next couple of pieces really speak to, what Lisa was talking about, what I know some of the discussion points are for the rest of the call, but really, do you have the right people at the table? So thinking broader than just our health partners, obviously we want to have our health partners there, but really making sure that we can go further with these coalitions by bringing more people to the table. And part of that is making sure we have the right spokespeople. So obviously having the spokespeople who can speak to health, who can have that more academic voice, but also people who can speak to other issue areas or people who can really speak to the impact that this is going to have on the community. One example of this with a coalition we're working with right now, where they decided to broaden their coalition because they didn't have the right spokespeople and they didn't have, they weren't representing all of the interests that they could have been. So this is a coalition in Oklahoma where they're trying to put a SNAP incentive policy in place. And their coalition originally was really just the health folks, but they've broadened that coalition to bring in the agricultural community because they know in that state that having that agricultural voice is going to resonate with a lot of decision makers. So now they have new spokespeople, they have new talking points to be able to move their policy forward. And really, when I was talking with my colleagues, every single one of them mentioned having that wide range of partners be part of the coalition. So some examples that we have from our recent work in West Virginia, there is a tobacco coalition that every single year there are bills that are filed to preempt tobacco control policies in West Virginia. And they've been successful in defeating a lot of those measures. And one of the things that's made them so successful is that they're not just speaking from the health lens. They obviously have all of the major health partners, but they also have people there that can speak to the impact this is going to have on business and the impact it's going to have to the economy in West Virginia. Another coalition from one of our campaigns was in Washington, D.C., focused on a sugary drink tax campaign. And when they were forming that coalition and the campaign was coming together, they were really thoughtful about making sure that their coalition didn't just bring together the health-focused organizations, but it had a lot of community members and it had organizations that represented the community. So as the campaign was coming together and as the bill language was being drafted, the priorities that they were including in there included priorities of what community members actually wanted to see. And it meant that they had those spokespeople as part of their campaign that could really talk to what the community wanted, and that one of the things they wanted was for this tax to be put in place. And then just with our preemption work specifically, there are a bunch of these cross-issue coalitions in states around the country where they're bringing together folks from health, from the environmental community, from folks that are more interested in minimum wage or some of those workplace protections, so that their coalitions have that broad reach and they can speak to a wider range of decision makers. So those are just a few of the tips and suggestions that we've seen from our work across the country, and I'm really excited to be part of the discussion after this.
Thanks so much, Katie. I think your suggestion about how do we find those right spokespeople and make sure the right people at the table are what we've heard both from Montana, and I think you had some great examples of where it's worked well and where we need to think about improvements. I now will hand it over to Dr. Alice Chen, who will tell us about Made to Save's work. Really huge effort over the last year, and I know has tons of lessons about what they've done working with different community partners and grassroots organizations, etc.
Hi, everybody. Just
Alice,
letting my Zoom share my screen here. There you go. All right. Okay. Well, hi, everybody. I'm Alice Chen. I'm a senior advisor with the Made to Save campaign. And for those who don't know, Made to Save is a national public education and grassroots mobilization effort. We were really sort of created early last year to build trust in the COVID-19 vaccines and increase access for communities of color whose health inequities had been exacerbated by the pandemic. So really created as a kind of a short-term campaign. We started last January and we're going to be running through the end of May. We are an initiative of Civic Nation. So Made to Save really sort of approached this as a campaign, and most of our staff come from kind of a campaign and organizing background, and our approach generally has been to really the kind of our overarching kind of North Star has been to strengthen the connection between communities of color and the public health ecosystem, and through this specific campaign. So we have kind of like two pillars of what we've done. One is empowering trusted messengers through funding CBOs, and then the other is a vaccine equity hub of kind of a broad range of partners, and having those universes feed into each other to increase vaccination rates in communities of color for kind of the longer range goal. So we've brought together a very diverse coalition across sectors, from kind of nonprofit to corporate to kind of government voices, folks who are in the civic engagement space, lots of folks in the public health and healthcare space, various different constituencies from kind of the Black, Latino, Asian, Native Hawaiian and Pacific Islander community, the Native and Indigenous communities. It's kind of, we set out to kind of build as big a tent as possible and bring in folks. And then we've specifically kind of dug in on granting. We've granted almost $7 million to 113 community-based organizations. And here are some of the fun pictures of them. This is a vaccine event at a Thai temple. And oops, oh, where did I put it? Where did I put? Here we go. And we chose organizations that were not necessarily kind of like the normal sort of like organizations that folks would reach out to, but really looked at who are the organizations who are very, very trusted within communities. And we chose counties and communities that had kind of a combination of being underserved, high levels of communities of color, and also in places that didn't have a lot of already existing resources. So we weren't in California or New York or Chicago. We went to like Memphis, and we went to South Dakota, and we went to some various other places. Our grantees conducted vaccine outreach in over 17 languages, and over 80% of those organizations are led by an executive of color. And some of these are like tiny, tiny organizations with 1 or 2 staff, but kind of a very passionate, kind of volunteer base and very deep connection to their community. And we've supported our partners in many different ways by creating coalition spaces to share and collaborate. So we have a national grassroots activation table that brings together everybody. So you could be a community organization, you can be, you know, APHA and the Alliance, you could be like anybody. Is welcome to come to these spaces to really collaborate across and have conversations across sectors that don't normally sort of have a lot of conversations with each other. And so we have we also had subtopic tables. We did field organizing and research table, a digital and communications table. We organized about 12 state and regional coalitions, kind of just zooming in on that vaccine equity topic. We have a health table. And then we did sort of like a wraparound support for everybody, because most of our organizations are not sort of like traditionally in public health. They're across the board. This is not their topic, but everyone said it's COVID. It has to be my topic because that was, you know, the entire universe a year ago. And so we, you know, kind of did wraparound services with public health updates and office hours, all kinds of different trainings, digital assets, communication support, research and messaging, outreach materials, and also brought in kind of the White House, HHS, CDC, FDA, everybody to have a feedback loop from the ground up and in the other direction too. Some of our key lessons learned. So one is, and I think I'm echoing what has already been said here, but an inclusive and open coalition drives the biggest impact. When we set out to do this, it was not like we're going to create a big brand and everyone's going to know who made to save it. It was all of these organizations have important work to do and have important resources to bring to the table. So let's bring them all in. And, you know, this, you know, organization on the border of Texas and Mexico has like these particular needs. Oh, like that organization over there has resources that they can use. Oh, and these folks can help in this way. So really kind of bringing folks together to use their unique strengths to help each other. Another lesson is that trusted messengers need support and resources with things moving so quickly, and with this not being everyone's sort of like primary topic that they focus on day in and day out. Really providing accessible and responsive support allowed our trusted messengers on the ground to do the hard work of doing that one-on-one outreach. And being able to provide the right resources required a lot of listening and letting community lead and tell us what it was that they needed. And then the third piece, we all know money is, you know, always a topic in public health, but really needing to fund people in the community to do work. If you want those voices at the table, is really, you know, so many of these organizations are just amazing, but they're very under-resourced, very overstretched. They're trying to figure out what they can, you know, what are the things that they can focus on. And so really, I think bringing some funding to them made a really big difference because they are experts in their communities. They do bring those voices that, you know, we in public health may not be able to sort of like speak to as well. And they have, you know, the trust, the connections, the understanding of like, what are the needs in this community? Like we had one grantee who they said, hey, we're in New Orleans, a hurricane just came through. We're not going to talk about vaccines first because nobody has running water. And so we're going to hand out bottles of water. And then we're going to do, you know, something else, talk about the vaccines because we're meeting the needs of the community. That's something I could never tell them that they needed to do. That had to come from them. And so that is, that's a quick whirlwind of what Made to Save has done. And I'm happy to answer questions.
Thanks, Alice. And I'm going to ask all of the panelists a question or two, but I'll start with you, Alice, because I know you just gave us a lot of information. I know you've now worked with all of these amazing community organizations as Made to Save, and hopefully the pandemic at some point kind of transitions on to, you know, a broader view about health. Do you have suggestions about how we can keep or opportunities to kind of engage these same coalitions in our broader alliance and public health work?
Yeah, I mean, a lot of our community partners are still very interested in continuing to do the work because it continues to be important to their community members. I think making it as easy as possible for them to engage, like speaking in like as accessible language as possible, getting rid of all of our jargon, having in-language resources for communities. I mean, we typically translated our main resources into 6 different languages, and then we partnered with other partners who brought in other languages as well. You know, our trainings were mostly in English and Spanish because we had partners who didn't, you know, Spanish was their main language. And so really making it as accessible as possible for folks to engage, I think is super, super important.
Great, thanks. And that was the same question for Katie and for Lisa. How did you engage these new partnerships, especially those that maybe either were just involved in the issue because they had funding, or how do we engage groups who worked on other preemption issues or other issues in the work that we're interested in now?
Sure, so I can start. Well, one of the things that, and this wasn't one of our preemption coalitions, but our coalition in DC that was focused around a sugary drink tax and really wanted to make sure that they had that strong community engagement. They really needed to think about, you know, some logistical things. When were they having their coalition meetings? You know, because if they wanted to have community members there that maybe weren't doing this as part of their day job, but just as community members, they weren't going to be able to show up during the day. So making sure that they had times that would work for some of those community members was really important to be able to get them there to have phone calls or Zoom meetings instead of in person back before COVID when they were having in-person meetings.
Thank you.
Yeah, and I'll just add that, you know, in Montana, our relationship with our Montana Association of Counties and our League of Cities and Counties is kind of all over the spectrum. And so really trying to figure out which county commissioners throughout our state, where they fall in alignment with those two organizations. And so we're really, again, just gauging the pulse. And there are a lot of county commissioners that are supportive of local solutions and of public health, and really trying to elevate those voices and really strengthen those relationships with our local public health leaders and allies is a big part of our local solutions work.
Great. And I know Alice, I think, needs to leave. So Alice, do you have any final thoughts for us on what the Alliance can do, both to lift up these community voices and, you know, move this work forward around health? We would love it.
Sure. I think a lot of folks particularly in communities that have been under-resourced and marginalized, they don't feel like they belong at tables. They don't necessarily feel like they're wanted or understood. And so I think it is really important to take that extra effort to invite folks in, and then when they're at the table to like invite their opinion. Like we did a lot of spotlights of our partners, in part because they were doing really cool work, and in part to say like, this is your table, this is your space, so that they didn't feel quite so kind of marginalized, whether by intent or not.
That's great, but also sharing those good examples and how things worked and really lifting them up too is great. So thank you so much.